New videos every day.
This is Athena Psychetruth, and today we're going to work on some lymphatic drainage. I'll get into some of the techniques a little bit for you so that if you're practicing in a practice, you can maybe begin to work with it a little bit, at least experiment with it and see how the hands work. If you're just doing it for your family members, you can have a little bit of an idea what to do. It's a modality that is a light, very light pressure modality, and sometimes the lighter pressure is more difficult to learn because heavy hands are easier always to do than light hands. And light hands also means that you need to understand what you're feeling because it's very subtle when you get into more subtle anatomy. So the lymphatic system is a series of vessels that are right underneath the skin. And so we're going to be moving them, and we have to open them in a particular way. And there's 4 quadrants, and they drain to various areas. So I'm going to be showing you now the head and neck and very upper part of the chest, draining that. So this is the drainage of the head, face, neck, and upper chest into the 2 quadrants. So it's the upper quadrants of the body. So to begin with, we just begin by starting at the top of the clavicles and a little bit behind them, and press inward, and then let your hand come up and float back. You do not go very deep into this. It stays right under the skin. There's the skin, the layer of fluid, and then the fascial layer, and you want to be right on the fluid layer. You want to be in the fluid, and that's where you're working with lymphatic drainage. Sometimes to go after a node, you go a little deeper than just superficially, but you still go very lightly into it. The nodes sometimes attract your hands as if it's a magnet. So you go around the clavicle area in this kind of a shape that is out to the point here and then back. That's the neck chain, and it runs up the sternocleidomastoid muscle, and then back along the trapezius muscle of the back is roughly where the nodes go. But first you open up the entire drain points, which is this ring around the neck, kind of like a pearl necklace. And then we go up the neck with little skin stretches. 3 to 5 times is what you want to do, and then you just ride it up. And there is a rhythm to it. So when you ride it up, you also want to feel that it has kind of a filling sensation. So you feel the fluid pushing out, and then it fills as it comes back in. And that's the rhythm that you'll follow. And then when you get up to the top, there's a big bunch of nodes where a drain point is called the water wheel. That's what I was trained that it was called. I'm sure it's got other names. And then we go down the back side. Now when you're working here, it's better to work across the vessels. In other words, if a vessel is running in this direction, your hands want to be like this, so you're not working the same direction that the vessels are going. So you're working across them, giving the skin stretching like that. That's where looking at an anatomy book and understanding how the vessels are, where they're moving to, and kind of seeing the flow pattern of them is very helpful. And you do that maybe 2 or 3 times on the neck. When you go back over it, like here we're draining it, and then we call it, in the Chickley method anyway, to rinse. And that's where you go back over it again and you just kind of rinse it back down. And it's kind of a reversed pattern of it. In lymphatic work, you always need to start proximal, which is closer into the body, and you move distally, which is farther away. It's like opening up little locks of water, so you're opening something so it has somewhere to move to. If you start farther out and you're draining it inward where it has to drain to, you're not gonna, if there's a blockage between there, you're not gonna be able to get the fluid up. So you have to open as you go. And that's one of the things that distinguishes lymphatic work from other work. In moving blood, moving the circulation, you want to start distally and move towards the heart. In this work, you do it just the opposite because we're in a different system. Now here there's a row of nodes underneath the chin. So we start and we just go under the chin very lightly and drain the nodes. It's actually right along the jawline. And then a rinse coming back down. Okay, and rinse that. And then coming back up. Now the draining on the face is there's a triangular from the nose kind of down this direction. This drains down and this drains to the side. So to drain down, the next thing after you open up this chain underneath the jaw down at the mandible, you come up to the chin and just start draining down. Move to the side and drain. Under the nose, you kind of come in and up and out. Kind of a little tricky one, but just move it. And on the edge of the nose. And you're draining downward on the nose, so it's going that direction. And just move up each time, a little bit more. Now when you get to the nasal bones here, the very top of the nose, I do a cranial move here where I'm grabbing a hold of the nasal bones with my fingers very, very lightly and pulling just slightly upward. This tends to open the bones, and it's just such a close relationship with so many of the sinuses in that area that it helps open the drainage a little bit just with the positional change of the bones. Well, this is not really lymphatic work, but it does seem to integrate into the work quite well. And then draining back down. And then draining back downward. And under the chin again, around. And after you get to that, then you want to come to the cheeks, and here we are, we're pushing this open. Now here it kind of seems like we're moving more distally, but that's our moving more into the medium. But this is the way it's draining, because you're opening here and then you're moving in. So there are some exceptions to the rules. But it's pretty obvious, and it makes a lot of sense when you understand the body. So basically you start in the center and move outward, but there are times that perhaps it's a little bit different. Then you come back to the cheek area and some skin stretching underneath the eyes. Now this is just little tiny pulls. This is very good work to do if you are an esthetician. This is an excellent thing to incorporate into your work if you haven't already. There's a lot of people that have had maybe plastic surgery or some kind of surgeries on their face for whatever reason. This work is excellent. The lymphatic work really helps healing process and helps with scar tissues to somewhat fade. And there's a lot of benefits to lymphatic work after any kind of surgeries or traumas, especially where there's fluids collecting. And then you can go to the eyebrows next, and the same kind of little pull. It's just very light work. Sometimes it feels like you're not doing a whole lot, but you can tell under your fingers that there's a lot of fluid moving. And then there's the eyeballs. This is you must be real gentle with this one if you're going to do it, but you do grab the eyeball and barely hold it, and then just rotate the eyes just slightly. You can drain behind the eyes this way. Okay, and then very lightly across the eyelid. There's kind of an upward motion on the eyelids. Upward toward the eyebrows and then draining. Okay, and then the forehead. It's pretty much open, so you can and then you can do the ears, where you put your finger right inside the ear there and just rotate each ear opposite back and forth. This will drain the ears. This is excellent for children that have ear infections. Oftentimes it'll help them feel better almost immediately. And there we go. That's the face and neck and just a little upper chest. The head, you can just push the head like so. It's just pumping, and there's the same kind of pattern in the back of the head. It's a triangular kind of thing in the back of the head as well, the way that it drains down into the neck. And then these drain into the water wheel area. Okay, this is Athena on lymphatic drainage of the face and neck.